bringing you into the conversation, sir. Another part of the UN population report, and if we can put out my screen on air for a moment so that I can read out the statistics given here. Dr. PSV Rao, a question was asked on certain barriers to having children and what are the most likely factors. Financial limitations was reported as the biggest barrier to having children, and that's something that I've tried to address with Mitali Nikore, but also other issues such as infertility or difficulty conceiving, barriers to fertility or pregnancy related medical care, and poor health, general health or chronic illnesses is also something that several people have chosen as factors when combined could potentially be 45 to 50% of the answers lie in these aspects of healthcare, general health. So in your assessment, Dr. Rao, what is it that we need to do as society and perhaps as the government as well as the medical fraternity to be able to give access to good quality fertility healthcare to young couples as well, and not make it so costly that only a few can have access to it? Because today, Dr. Rao, let's be honest, most of us have some sort of disease or another. Some sort of lifestyle disease impacts everybody today.
Good evening, Devika, and the panelists and all viewers. I hope you can hear me clearly, because
Yes,
I
sir,
couldn't
yes.
hear your question very clearly. Yeah, I think you were emphasizing on the fertility issues of delayed marriage and delayed pregnancy, which
Yes.
follows higher education for women, better job opportunities, etc. They will invariably delay having a child. Now, the problem is that women have a certain number of eggs, then that cycles every month. One egg at least is lost. So what happens is, in men the spermatic count does come down with the age, but they don't have the kind of limit because they are constantly producing sperms into old age. Whereas in women, they are born with a set of number of ova. So they don't keep producing more ova. These mature on a monthly basis, and this is why fertility in women rapidly decreases with age. Secondly, the chances of genetic defects in the children they bear increases the older the woman is. So this is an issue that is very difficult to biologically deal with. Now, if you ask women to marry early and have children early, like it happens with those populations where the birth rate is high, then how do you give these women equal opportunity and equal education? Because once they may get educated, but then if you expect them to be working in a workforce, and we have had people in India, you know who they are, who have talked about work, why 40 hours a week, they want you to work 70 hours a week if possible. So how can a woman bear a child, take care of it, breastfeeding, etc.? Now it is easy, men can help, but there is a limit to how much men can help. Men can't bear a child, men can't breastfeed. So these responsibilities land up solely on the woman. So even if the husband is very cooperative and willing to help, there is certain things that limits the lady's ability to go to work, and you know how the commuting itself is consuming a lot of time. There's a lot of stress. So if you look at it from the lady's point of view, it becomes very difficult for her to manage so many things. She's expected to manage the home, she's expected to manage the child, and then expected to do work. So these are the problems that are occurring in managing that. So you can't have, see, when I became a surgeon, when I joined the surgery department 46 years ago, women were having 10 to 12 children each. Now women are struggling to even have one child, because because of education, because of delay in because of professional responsibilities, and the financial problems have already been detailed by Dr. Kohli and by Mithali. So these are all issues that affect the
Yes.
fertility rate, and we have to worry about if there is too much delay, then there will be a high incidence of birth defects. And you see in US now they are crying about the high rate of autism and various other birth defects. So these are all issues that have to be thought of. And anyway, if you look at it from the environment point of view, then it is anyway good if the population of human beings stabilizes world over, because there is a certain amount of population that the world can sustain, and if we keep going on increasing it, it becomes difficult. And as far as taking care of elders, as the population pyramid gets inverted and there are less young people and more elderly people, I think eventually we will have to have automation to take care, and the reversed pyramid will eventually become a cylinder. It won't be, there will be a stage in an advanced society when the children and the elders are same. But automation and such advances will help us. I am quite aware of the problems of this population inversion. Yes, Devika.
Yes, absolutely. On that note, Sharad, just one last point with you. I just have a minute or so left.